Hello. Today we're going to talk about family response to pain and pain management. Really talk about caregivers and the impact of pain on caregivers, caregiver roles, and some other aspects of caregiving. So I think this quote is very apt in demonstrating the widespread number of caregivers and how caregiving is really going to impact all of us at some point in our lives. Rosalind Carter says there are four types of people: those who are caregivers, those who have been caregivers, those who will be caregivers, and those who will need caregivers. So there's more than 43 million US adults that provide unpaid informal caregiving to an adult or a dependent. So these are caregivers that don't have education or training around caregiving. They're informal, they don't receive payment for their care, for their services. And on average, they provide about 19 hours of care per week to someone who needs care. As our society ages, we will see the need for caregivers rise by 85%. And this is not just because we're going to see more people that are old. It's that we also are experiencing people that are living with chronic illnesses for longer periods of time. So as people continue to age, they're experiencing more chronic conditions, and they're living with these chronic conditions for longer periods of time. So when you look at the picture that way, you can see that not only are we going to need more caregivers, but caregivers are going to be needed for longer periods of time. About a third of caregivers report that their caregiving disrupts their daily life. And when we look at caregivers of patients who are at end of life, this rate is almost double. It's about 58%. About 20% experience financial burden, and about 15% have some type of family burden, and 10% report some burden to their own health. The estimated cost of care provided by these unpaid caregivers is $450 billion. So you can imagine what our healthcare services would look like if we didn't have these caregivers. So without these caregivers, we would probably see a tremendous rise in the use of medical services, more emergency room visits, more hospitalizations, and significantly more patients in nursing facilities and assisted living, because they would need to be able to go somewhere to receive the support that these informal caregivers are providing. So there's a lot of unmet needs of family caregivers. There's family caregivers experience depression rates. Up to 44% of caregivers experience depression. And about 50% have lower than average health status. So these caregivers aren't in the best psychological and physical shape. They're oftentimes socially isolated, so they're spending more time caring for the individual at home, and that's cutting into their other activities, whether it's work, social activities, interacting with family or friends, and just general social activities they may be doing for their own pleasure. So many of these caregivers have needs that are equal to or greater than the patient themselves. So there's a lot of challenges of caregivers or caregiving challenges. One of the things that's interesting to note is that caregivers may not identify as a caregiver. They may not know that they are, quote, caregiver. They just know that they're taking care of their family members. So if they don't identify as a caregiver, then if somebody says, here's some caregiver resources, or they see something that talks about caregiver support, they wouldn't necessarily think that that would be something for them. Or even in healthcare, they may ask, who is this person's caregiver? And they're like, well, they care for themselves, because they don't necessarily understand what that term is, or they don't necessarily understand that that role is their role now. It may be very insidious, so it developed over time. So it could be that they don't understand the term, or they don't necessarily recognize that role as one that they're doing. There's also a huge lack of knowledge of caregiving activities. So we depend on these caregivers to do everything pretty much. So how do they know that individuals that are bedbound or that aren't very active that they need to be moved and adjusted frequently to avoid pressure ulcers? Oftentimes what you'll see is that somebody ends up in the hospital or the emergency room because they have a pretty significant pressure ulcer, and that's the point after the pressure ulcer where the caregiver gets education and receives information about this. And this is really, really difficult because once they have the pressure ulcer, it's so hard to get rid of it. Rather than being able to receive that education early about skin breakdown and the need to to move the patient around. Same thing with medication management. Medications are a huge challenge for caregivers. Oftentimes they're very complicated. Pain meds in particular could be PRN as needed. So they struggle with when is that? What does that mean as needed? They may also have no experience in providing pain or medication management. So this is very, very challenging for them.